Keller Williams Fort Myers, and this is part of our series that we're doing online with our hyper-local website, and we're so glad that you joined us. I'm here today with Dr. Ford. He's a dentist in our area, in our community, and I'm so glad to meet you. So we've been talking a little bit about his family and his work here, so I'm really excited to introduce him to you and let you get to know him a little bit. So Dr. Ford, why don't you just tell us a little bit about yourself and introduce yourself.
Well, I'm Dr. Ford. I'm been in practice here now for about 9 years, been in the area about 13 years. Originally from Michigan, we were just talking about in the Grand Rapids area. My wife's from here, so she brought me down, and we've again had the practice for about 9 years, and just love the area, love being part of the Fort Myers community, and love kind of establishing my dental practice.
Very cool. So do you like shoveling the sand here more than the snow?
Much better. Much better.
Very cool.
Don't miss the snow at all.
No, I get it. So why did you choose dentistry? Dentistry is kind of a calling versus, just wake up Wednesday and go to work. You had to choose this. What made you choose that?
Well, I was always a math science guy kind of growing up, so I thought about medicine. And my neighbor was my dentist, and he kind of talked me into all the positives, and there's just a lot of great things with it, from working with your hands, getting to work with people, and getting to know people, building relationships. Really the thing that I like to do from a cosmetic side is change people's lives. And there's an art to it, which is just kind of nice. My mom's an artist, so I kind of grew up in that world.
Gotcha. And
then being able to be a business owner. A lot of medicines kind of change where you're not necessarily in charge of what you want to do, and I love that aspect of it, not only from just kind of being and running a business, but also being able to select what I want to do and not want to do, and I love it.
That's cool. So tell me about one of those patients where you changed their life. You have one you can share?
I have. Well, there's one that comes to mind always. I had a guy who had a lot of spaces in his teeth, really dark teeth from a young age. Always self-conscious about his smile, and he's probably in his 50s to 60s, and one day just said, I want to do something about it. Came in here. We were able to basically within a month totally redo his smile, and when we first put it in, he was crying, so it was one of those moments that makes you happy for what you're doing for him, and it was life-changing for sure. So things like that just make the job worthwhile.
So they probably boost their confidence and who they are and everything. That's really cool.
It's why I love what I do.
Yeah, before and after pictures you put up somewhere?
We do. They're all over the office.
Good
website, kind of all over. And like I said, that's kind of my passion is the cosmetic side of things, and being able to give people that smile they're looking for.
Sure, that's cool. I love your email, by the way, smilesbydrford.com.
There you go.
That's really cool. I saw that and I went, whoa, that's awesome.
Yeah.
Very cool. So tell me a little bit about your practice here. You love the cosmetic side. Do you do like the full range of services, or?
So it's basically a general practice with the emphasis in cosmetic and what I would call comprehensive dentistry. So kind of looking at everything that, we do emergencies, but not just trying to look at a tooth here or there, but really looking globally about your gum health, your teeth health, the cosmetic, kind of everything, and trying to really get everyone to optimal health. And as far as services, my bias is always try to give the patient the best that you can. So I'm not, the jack of all trades. I'm not doing, root canals and surgery and implant surgery and everything. It's more, I'm going to do what I do well from a cosmetic and restorative side, and then I have a team of people that will do surgery or do root canals. That's what they do all day long. well.
Sure.
You know, I always compared, you know, patients to say, you know, if you had to get your knee done, would you want the guy that only does knees, or do you want the guy that does knees, shoulders, hips, and everything?
Yeah.
And so, you know, that's kind of always my bias, if you will.
Yeah. So you have a network of friends or associates that you can refer to. So that's good because I wouldn't know who to trust. You know, I don't know. And if I have you, then I could be assured that I'm going somewhere that has a good reputation, I guess.
Right. Yeah, we have some really good relationships that we've built with,
Good.
you know, people that I trust and know that, hey, you're getting the best work you can here in this area.
No, that's awesome. That's really good. So, so what are your goals for the next few years that, you know, as you grow your business?
I would say just kind of keep doing what we're doing. I mean, we're really, you know, we've gotten really busy, especially with the boom of people moving down here. Just trying to accommodate, you know, as many people as we can, and you know, just keep, you know, creating new smiles and changing people's lives, and you know, just trying to give people that optimal oral health, and that's kind of my goal.
You talk about optimum oral health. This is not on our notes, and we're going to go off script a little bit, but I just read something or heard somewhere a few months ago where oral hygiene can actually affect the brain and can affect, I guess, inflammation in the heart. And I didn't know all of that, so I guess it's more important than maybe I even thought it was.
It is definitely, you know, over the last, let's say, you know, 10 years, there's been a lot of research done about oral health, specifically, you know, the gum inflammation and how that correlates to heart inflammation, diabetes, arthritis. You know, there's kind of a list of a lot of things, and it's just, which I think a lot of people study now, just inflammation in the body, you know, isn't good, and it doesn't not include the teeth and the gums, and so we definitely try to make sure that gum health and any inflammation that's there is treated and as healthy as it can be.
Yeah. Well, that was just a little shocking to me that how much that could impact the rest of the body. I'm like, it's in my mouth, it's not in my heart, but
we get that a lot.
Yeah, I bet you do. So what do your patients love most about your practice?
I would say, you know, it's kind of a family atmosphere. So we, you know, we have a lot of patients that our hygienist has been going almost 50 years now.
Wow.
We have a lot of patients that have been with her for a long, long time, same with our front desk. But it's really, we try to be inviting, we try to build, hopefully, whether it's your first visit or you've been here for 20 years, that lifelong, you know, relationship where we get to know you, you get to know us, and you know, hopefully have that where you know who we are, you know about us, you know about our families, and also we're getting, you know, optimal care as well, and knowing that, you know, hopefully things aren't failing quickly, and you're getting the work done that you know need to get done.
Yeah. So when I came in, I just noticed how personable everybody was. You know, it was just like, hey, do you want water? Do you want warm, cold? Do you like bubbling?
I'm big into customer service and treating people well, and,
that's cool.
and trying to make it a good experience, because like we had touched on at the start, a lot of people don't like to come to the dentist, and you know, any little extras we can do to make it a little bit more comfortable, to ease that maybe a little tension, we try to do that.
That's cool. That's really great. So we talked about the most memorable patient experience, and that's really neat, and the services you offer and the referrals you can do. Is there anything else you want to share?
You know, like I said, you know, my goal is always to give the optimal care, and you know, I have a passion for dentistry. I'm always out there trying to find the latest technology, the latest way of doing things, and trying to deliver that to our patients. We were talking again a little bit at the start. We just got a brand new 3D printer that's 3D printing models and night guards, and just the technology changes in dentistry over the years have been amazing, and they're not stopping. They keep changing things every year and getting new stuff. So it's cool, the future that we have going.
So you keep the technology going.
I do.
That's good.
I'm a tech junkie.
Patients, if you need to schedule a cleaning or any of that, do you recommend regular, like, appointments for that? And how
Yeah,
often?
yeah. So typically, you know, with for us anyways, for a new patient, we try to get you in. We actually take a full series of photos. We take X-rays and really just have a comprehensive look
Yeah.
at everything. And then it's just getting you on the maintenance schedule, you know,
Okay.
every 6 months or whatever it may be, and kind of bringing you on as part of the practice.
Good. So you see the hygienist, and then I guess you do a look around, or does she just let you know what you need?
Depends on the case, but usually actually you'll see me first to
Okay.
kind of see again what you would need, and then we get you over with the hygienist, or it's kind of a team effort,
Sure.
and then depending on what type of cleaning you need or where you're at, we kind of go from there.
Okay, sounds good. Well, it's a pleasure to meet you. Thank you
Good
so
to
much
meet you.
for
Thanks
taking the
for
time. Yeah.
thanks for having me, and
All right.
yeah, I enjoyed it.
All right. Thank you for watching.